Hi, everybody. Welcome back to another episode of Teens No Cap. I'm your host, Charity Chaffee. I'm a teen mental health specialist focusing on the treatment of high-risk adolescents and teens. And you are joining me today to talk about EDS. If you're not sure about what EDS is, we're going to get into all of that. But I have an amazing provider who's based in Texas, and we're going to chat all about EDS in teens and families and how to navigate that entire messy system. So I hope you'll join us for the rest of the episode.
I feel like I love that you're hitting on this as a parent because it's something I wish I had. And I mean, she is a teen with EDS, but she was a child with EDS, and we knew. And so, but there wasn't a whole lot of anything. And so, I learned by trial and error, and I'm still learning by trial and error. you know, and in terms of parenting, and there definitely are times where I have to look at my husband and I'm like, this is your EDS right here. This is as an adult. Okay, so here's how this all went. It played out. I had a really icky pregnancy with her, and then I got laid off 5 months before she was born. My husband got laid off the week before. We were the poster children for the 2009 recession. He got laid off the week before. So 2 weeks before her due date, he got laid off. So we induced a week early for insurance purposes, which was a terrible decision, and I swore I was never doing that again ever because it was so bad. I'm like, don't give me Pitocin. I don't want anything to do with it because it was so painful. And then I had some hemorrhaging a couple of weeks later. I have some gynecological things that are weird. And so just like personally, and so all the things happened. And then my aunt works in early childhood development at one of the programs in the county that we grew up in. And I was showing her at one of, actually, I think it might have been Christmas. I was showing her I could take my kid's ankle and twist it almost 360 degrees with no reaction, like at all. Like she just didn't react. She didn't feel it. It was like, and like there were times where I would find her in her crib with her legs out, like in a straddle, flat on her stomach, like just completely flat, sleeping. And I'm like, I'm really flexible. I was a cheerleader in high school. I was the one who did the splits to stretch. I, as a 44-year-old, can still do the
Ooh,
splits.
impressive.
Like, not the middle splits, but both sides. Um, actually, if I'm stretched out enough, I can do the middle splits, but I have to work at it. Like it's not like I can't just like down
Right.
into the middle like I can on like my right side, right? So I'm flexible, but not like that. Like we told people, we're like, she's like Cirque du Soleil flexible. It's a little freaky, right? Weird things with her shoulders. She's got a hitchhiker's thumb, and it's really, really pronounced. All of the things. And so I showed my aunt her foot, and she goes, Becky, that is not what it's supposed to happen. You need to get her evaluated. She wasn't walking. And then at this point, she was like 9 months old. She wasn't walking, all of these things. And so we were like trying to figure all this out. I have 6 siblings who are younger than me, had never seen anything like this, even with them. And so, and at least 3 of them, I was old enough to really be conscious of them as babies, you know? And so we got her evaluated. Sure enough, so we ended up with OT, PT, and speech therapy because her EDS impacts her enunciation, and then also started to impact her spelling. Like it was impacting her education in kindergarten. She couldn't spell because she couldn't say things right. So we ended up with speech therapy again, like in elementary school for the same, like we have to get this fixed so that she can hear it correctly and spell it correctly and all the things. It was wild. We did a heart monitor at one point because like a 24-hour heart monitor because she had a couple of moments where her heart rate spiked up over 200 for no reason. Like she wasn't running a fever, she wasn't sick. She just all of a sudden it was skyrocketing, and I'm like, this is not right. But EDS is a muscle thing, and your heart is a muscle, and so like we're just you know doing all the things. And we went to see. They referred us to physical medicine and rehabilitation at the University of Michigan, and the first appointment with her PMR doctor, The doctor looked at her and said, yeah, she needs orthotics. Like she needs braces on her feet that go to her knees so that she can walk. And then she made both me and her dad stand up. The doctor made both me and my husband stand up, pull it with our shoes off and pull our pants up. And she looked at our feet and she looked at him and said, it's from you. Because his feet do the same thing, just less intensely. So when she finally did learn to walk, she was walking on her ankle bone on the inside, like super overpronate. And we put her in braces. She was running within a week because she had the right support. So we did years of that stuff. And then now she just wears orthotics in her shoes, like an insole kind of thing. But we have to buy special shoes for her. Like we only buy Brooks for her because they're the only shoes that have the right support on the ankle for that reason. She's constantly got headaches. She's constantly hurting. Like, and I've had to look at her and be like, I love you, and I know you're only 16, but you need to understand that like this is not ever going to change. You're just going to hurt. And I think the hard part for us, even for her dad who has it, and we did figure out it's from his, so it's from him, and then it's from his dad, and then his grandpa. And we don't know beyond his grandpa, we're not sure where it came from, but like I looked at their feet and I was like, oh, okay. And it just progressively got worse to the point where my daughter knows that it progressively got worse. She's like, I'm not having kids. I don't want to pass it down because it's a dominant gene. So you're basically guaranteed a 50-50 chance of giving it to your kid. And, so she's just like, I'm not doing it. I don't want to do this. And I don't know that that's going to be 100%, what happens. She may change her mind, but I don't blame her either. As much as I would like to be a grandparent at some point when she's old enough, not in the next like 3 years, please God. Um, but like I get it. Like I understand. I wouldn't want to pass that down either, especially since it's gotten progressively worse through the generations. Because it for them it shows up as like like almost like arthritic symptoms, especially when it's cold. Like their joints hurt, and living with two people who have it is really hard, and like there are times where I just want to look at her and be like, you need, and I've said this, you need to stop being a bitch. And then I have to backtrack and be like, wait a minute, is this an attitude or is this pain? And as a parent, I just want the attitude to not be there. But then the counselor part of me is like, well, it might just be pain, you know? And then I started working with I had a client pop up. I contract with Teladoc. So I had a client pop up on my caseload, and she was there ostensibly for relationship help with her marriage, like just boundaries with her husband and that kind of stuff. And during the intake appointment, it came out that they had literally just gotten a diagnosis of EDS for her 17-year-old daughter. And I was like, oh, it's not your marriage you're here for. Like, I can walk with you through this. Like, I've been there, Um, and I think what we were blessed with was getting a diagnosis super early so that we could. Now, we didn't do the genetic testing. They were like, we don't need to do all the pokes and prods to confirm genetically that this is what this is because the treatment's the same no matter what. Um, we could have done it. We just chose not to torment her that way. So we were able to do the research and be like, okay, what are we looking at? What does this look like lifelong? Like, how do we support her? Those kinds of things. This poor mom has been through the last 3 years of gaslighting from the medical community because her kid is passing out in band practice, and and they're in Texas, and band is during the hot part of the year here, like marching band, and she was a drum major, and she's like getting dizzy and passing out in band because she's getting overheated and her body can't handle it, and like all of these things. And she's emotional, and the word bitch got used. Mom's telling me this, right? And it took going to see a rheumatologist for them to get a diagnosis, and it took like a year and a half. And mental health being crappy, and boyfriend not knowing how to handle it, and just all of those things. And kid thinking there's something like super wrong with me as a person, instead of having an answer that it's not my person that's wrong, like there's just something not right with my body, you know. And I felt for her. Like, for the teens that go through this, for and even adults, like there's something not right in the system as a whole when a patient comes to you and says there's something not right, and you don't listen. And like I said, I'm super blessed that my aunt looked at my kid and looked at me and said, "That's not right. You need to get evaluated." Because we would have gone. We would have been like this other, like my client, who went years not knowing, you know. Um,
Well, and this was your first, right?
it was my first. My second does not have
So
it.
I think that's the other thing that I would like love to take a second and just point out is that when you even like the therapist in us, right? We are
Hmm.
not trained in 1,000% of everything in terms of human
Right.
experience, right? And so oftentimes when
Right.
you physically have your first kid, you are like really trying to decipher what is normal, what is textbook, what is like
Hmm.
abnormal, right? And so many
Right.
people make the statement of like, oh, like it's a baby, it'll be fine. Like they'll develop how they want to develop and like they'll get there and every baby develops at their own time, right? Which then
Hmm.
I feel like kind of puts this like weird grief anxiety on a parent because you're like, okay, so then what am I doing wrong, right? Like if my kid
Right.
can't get this like milestone or I'm doing
Right.
these things, like what am I doing wrong, right? So when you had said
Hmm.
in the beginning, you're like, it was a lot of like figuring things out. That is like so much of
Hmm.
it in terms of like you have this
Yeah.
precious new little baby and you're like, I need to figure out like what all these pieces are. And every kid I wish came with an instruction
Hmm.
manual, but they don't, right? It would be so
Well, and every kid's different,
well, and that,
because
yeah, yeah.
number two is vastly different than number one, in a lot of personality and the medical stuff with her. And I mean, there's a whole nother story with number two, uh, but not chronic. Well, she has asthma, so I guess there is some chronic. But yeah, like they're so different, and you don't know what you don't know until you find out you didn't know it. And I think, again, this is where I was blessed. I had somebody who could look at me and say, "That's not right." And then I had people from early childhood development who were able to come alongside me and say, okay, this is what should be happening here. And then the providers were listening because we were coming from somewhere else. Because I had an OT and a PT who were saying, no, there's something not right here. So I didn't have providers gaslighting me, as opposed to if I were doing this now with a 16-year-old going, I can't figure out why she's having headaches. I don't know why her body hurts. I don't know why she's like constantly angry. Like, I don't understand all those things. I think I would be like, I'm going crazy. It's not just my kid who's struggling. Like, why can't people listen to me? Like, why won't they listen to me? And it would even go into to the school too, because you need a 504 for some of this stuff.
I was gonna ask. I was curious, like, with as a parent with a kid with EDS, right? Like, when we're thinking school accommodations and collaboration, like, what do you feel like is important?
So mine doesn't have any accommodations at the moment, but we homeschooled for 7 years. Like, we were already homeschooling when COVID happened, so pre-pandemic. So when the pandemic happened, it was like, oh, we're just going to roll with it because we've been doing this for 3 years already. And then last year, both kids were like, please let us go back to school. And I work from home, my husband works from home, and it had hit a point with, a ninth grader and a seventh grader that I was like, I can't do the teaching part or even the helping part anymore. Like, I need you to be in a classroom where you have teachers, that you can ask questions, as opposed to we were doing private school at home. So it wasn't really full on homeschooling. They had teachers, but their teachers were doing that particular school as like a second job. So they didn't have access to them all the time. And so, yeah, so we haven't necessarily had to do any accommodations. Like this daughter with EDS also, I have full disclosure, not diagnosed, but ADHD, and I believe she's on the spectrum also. So add that into it too. Like, so it's like a whole bundle of all the crazy stuff. Not that she's crazy, but just all the crazy things together that come from that mixture of things. And she asked me this summer if I was going to pursue, like, I would have to get her a medical diagnosis in order to get any accommodations because she doesn't need them academically for like the ADHD and the autistics. The kid's a straight A student and she's in honors classes and AP classes and like she's just a good kid. She's a good student. Now, she's taking PE this semester and there have been a couple of times in PE where I've almost called the PE teacher, like the coach, and been like, "Look, my kid can't do that." And it's not because she doesn't want to, it's because she can't. But she has made her own accommodations. And that was something we saw when she was a baby. She adapted on her own. Like she realized, oh, my hand's getting tired, so she started using the other hand. So she's kind of figured that out on her own. So we haven't done that necessarily, but I think that's because we had all 16 years basically of kind of figuring that out of like what needs to happen, what doesn't need to happen. If it gets to a point where we're going to need accommodations, I'm more than willing to fight that battle. But EDS specifically is such a invisible thing, like it would be fighting an uphill battle to get accommodations at the school, I think. And like my client has kind of experienced that with her daughter because it's invisible until she passes out.
Well, that's part of why I asked, because I feel like when you have a teenager, I feel like there's all these kind of assumptions of like, oh, they're making a choice, it's behavioral, they're trying to get out of it, it's manipulative, they don't actually have it, they're just following what their friends have. So there's, and particularly with like any sort of mental health thing or like chronic illness, I feel like that's often the response. But when you think about like way back in our training as therapists, one of the very first things they said was to rule out any medical condition. But then it's like getting the providers to take you seriously, getting the providers to really understand, and like sometimes like EDS and other kind of chronic med stuff, it takes a certain commitment from a provider to really push that through and get it. And it sucks that like people are so late in getting their diagnosis, because it's the same thing with like autism and like other mental health pieces, where it's like the earlier you can get a diagnosis and receive treatment, the better the outcomes are.
Yeah, man, it's kind of similar to the recent change in standard of treatment for like hormone replacement therapy, like how they're kind of changing that again. And they're like, oh no, it really doesn't cause cancer and it's really good for you and you should start it perimenopause. Except, like, I have another client who I like just started with this week who's saying hormone replacement therapy is off the table for herself, but she's like literally going crazy. Like she said this, she's a counselor, she's a school counselor, and and she's saying I can't do hormone replacement therapy. I have bad reactions to it. And I'm like, well, what are you talking about with hormone replacement therapy? She goes, well, it's birth control. I said, that's not hormone replacement therapy. First of all, it's synthetic. It's not your hormones. It's not the same thing. It's not like being put on estrogen and testosterone and progesterone and probably thyroid in her case too for various reasons, or vitamin D because ADHD, or all the things. you know, eh, but like you have to fight that battle. Like you have to go to your provider and say, no, I want the real stuff. I don't want birth control. I have a teenager, a teenage client. She's 17. I'm working with the client, not the mom in this case, and she's had significant anxiety and depression tied to some other things, but they put her on birth control. And the first session told her mom, I said, take her off the birth control. Talk to your doctor about something different. I said, I can't make that diagnose like that prescriptive for you, but birth control causes anxiety and depression, or it makes it worse. And it's literally, I said, go to your doctor and say, can we look at hormone replacement? Like, can we get her hormones tested? And I can't tell you how many times I've had a woman on my caseload who's like telling me all these things. And I'm like, when was the last time you had your hormones tested? When was your last blood work done? It's like, and then they're like, why has no one ever asked me that question? And my response is, well, that's how I was trained. You rule out the medical first. Like, I want to find out if you're really having bipolar symptoms or if you have, hypothyroidism. Like, if we're dealing with Hashimoto's, it's not the same thing. And yes, it looks like the same thing, but you don't treat it the same way. Like, I'm not gonna say, hey, you need to go see a psychiatrist for lithium if it's Hashimoto's and you just need thyroid. And so I think, like, unfortunately, the hard part about kids, like you said, is so many people, well, babies are babies and they develop at their own rate. And pandemic babies are even more different because they miss their milestones are coming so much later because of pandemic stuff, that, like, now we're like, okay, where are we at? Like, I don't, I mean, I'm thank God my kids are teenagers and I'm not dealing with baby stuff right now. That's all I have to say, because I don't know that I could do it, because it's so vastly different from what you would consider to be normal, facial recognition stuff and talking and all of those things. I don't know. But when you have a baby who's crying constantly or not talking, and the autism thing with my daughter started showing up a little bit different than, I mean, she's a girl, so it's going to show up differently than it would in a boy anyway, but it didn't really start showing up until actually like middle school. I mean, I noticed some things, but it was much more like the super overstimulated, super rigid, can't handle change kind of stuff that showed up. And then I'm really, really interested, and I'm going to just go down the rabbit hole on this one thing, and I'm going to be obsessed about it. And so, like, but when you have a baby who's crying, how do you tease out, is this maybe autism because they don't have any other words, or is this because they're hurting? Like, it's that was where I was going with what I was talking about a minute ago. Like, teasing that out, because babies are different and you do experience things differently. And, like, my youngest is much more anxiety prone than her sister, except the sister has anxiety than my older, but hers is because she was a preemie and she spent the first 3 weeks of her life in a NICU. So, like, you're like teasing some of those things out, and wait, why does this one do this and this one does this? And how do we manage, and, like, what's good for my kid? You know, one of the things the PT said to us was, don't let her do sports that are lots of start and stop, because it's not good for her joints. So they're like, you need to put her in a sport that is all the muscle groups all at once. So swimming or dance, or we do karate. And actually we do karate together, like, where you're focusing on everything, like whole body stuff. And that's something, interestingly enough, the karate has helped again. We did dance for 8 or 9 years, and she was in less pain most of the time when she was dancing than now that she's not dancing. And I think it was because she was using all those muscle groups properly. Karate has started to help with that. We just don't do karate as much as we did dance before. The client who has EDS used to swim competitively, and she was not the symptoms started showing up real bad after she stopped swimming. And I think that maybe that's what's happening, is for whatever reason, you have EDS, you learn to adapt. I think you just do it because you don't want to hurt. And then when you don't have those adaptive strategies anymore, that's when it, like, spirals. And that's when you start seeing the things. And then you have providers who just don't understand and are not humble enough to ask the right questions or admit they don't know. And I think that's where I'm so grateful we had what we had as a parent. As a provider, I wish more providers were humble enough to be like, I don't know what's going on. Let's maybe, like, do some research and tell me when it happens, and, like what we would do. Tell me more about that. Wait a minute, go back, rewind a little bit, tell me about that, what happened there. Like, I think if more medical providers had some, even just a little bit of counseling training, it would be so much better across the board, for adults, for kids, for teenagers, men, women, especially women. um, because it's a male dominated field.
Do you think though that like the thing with providers is like insight oriented in terms of like they really don't know, or do you feel like it's awareness in terms of like them being able to pick up and put together patterns that might like indicate some sort of chronic med issue like EDS?
I don't think it's an either or. I think it's both and. I think it's an insight issue. I think tied back to they're not always necessarily humble enough to ask the questions, especially when they're older. Like if they're of an older generation, so think 60s or more, late Gen X or, older Gen Xers into the boomers. If they're in that age range, they know everything. And the hard part about it is like we know this as counselors because they talk about it in all of our training, in a lot of our classes. Research is 30 years ahead of practical implementation. That's why the stuff with the hormone replacement therapy is just now coming out because 30 years ago, we're now finding out what it actually said 30 years ago, basically. Same thing goes for stuff in schools. It's, almost always 30 years behind what the research actually says. So you've got these people who were young in the 80s, now they're older, more mature, which has its benefits, but also often means they're set in their ways. I know I've done whatever, not as curious about things. So I think it's partially that. I think it's also awareness. I think it's also that EDS is only very recently coming for, like being something, it was it's really pretty rare. Actually, it was something the PMR doctor told us was like, this is like, it's not something you see very frequently. That's why she was really surprised to be able to pinpoint which parent it actually like came from. Like, yeah, no, it's definitely from you. So I think there's some of that. I think the other thing is that even 30 years ago, and I think some of it probably is tied to, diet and a lot of the other things, holistically speaking. 30 years ago, we weren't putting as many chemicals in our diets as we are now, so we're not pulling the trigger on certain genes like we are now. And so if you were a young doctor 30 years ago, you weren't going to see this stuff because some of the things that would pull the trigger on something weren't in the food or weren't in, whatever. And we didn't have an obesity epidemic and we didn't have this going on. We didn't have this going on. And so, and then you get 30 years down the road and they're used to this. And if you get a younger doctor, they're young, so sometimes they think they know everything, but most of the time they're like, I don't know everything. So let me ask some questions here. Not always, but in my experience, often you're better off with a younger doctor, even if they're younger than you, because they're semi-aware that they don't know it all. And they're more aware of the recent research because they're closer to school. I think that's why I think it's a both and. I think which is a hard thing to combat. Like, I don't know how you combat it other than like, here, let me put it right in your face. Like, let me show you the research. Stop avoiding me, ask me the right questions. And then the other thing I think is you get parents who get discouraged and you just stop. You get to a point where you just stop. And I will say, unfortunately, I did that when she was in kindergarten. I knew she needed speech therapy still because we were still having a hard time understanding her. And we were getting that, no, no, that's normal for her age. It'll adjust. And I'm going, no, no, it won't. And, here I am, a counselor who's helping other families get IEPs for their children, and I can't get the school to listen to me because in their mind, I'm just this overprotective parent. And that was in Michigan. And then we moved here to Texas, and within 3 weeks, her kindergarten teacher told me she needed speech therapy. And it was because she was having trouble spelling because she couldn't hear the words correctly when she said them. So we did it, and sure enough, we did like 2.5 years of speech therapy, and then we put her in theater. And they worked with her on enunciation, and that's helped. But I had given up. I was so happy that her kindergarten teacher was like, I think she needs speech therapy. Because then it wasn't me trying to beg, it was a teacher who had identified it.
It also
Um,
probably gave you a lot of like validation,
yeah.
right? On that initial hunch of like my kid needs
Hmm.
like more things. And so like I'm so
Hmm.
glad that that person like spoke up and was like, "Hey, I can see this." Because I do think you're right. Like
Yeah.
I think there's a lot of people that go into something and are only willing to like half do it or only half committed. And that's why I feel like, especially working with like teens, working with like complex medical stuff,
Hmm.
working with like chronic illness, it's like you really have to have that like deeper investment that you're not just going to be like, sounds great.
Yeah. And I mean, they're definitely, full disclosure, I'm a counselor and I struggle sometimes to like get my kids to see a counselor.
Yep.
you know um but, but part of that is because I can look at her and be like, I need you to breathe with me right now, and we just do it. But that, like she needs her own person. Like we're just in the middle of a big transition, and doing that is tough. And I feel that for parents, you're dealing with medical stuff. It's hard as a provider, like especially when you're in the beginning stages and you're figuring it all out. And then I mean, like my client said her daughter all of a sudden was like, it was like a relief because she was like, okay, I have a name for the monster, and the monster's name is not my name, it's something different, and it's not me. It's just a thing I have and that I have to deal with. And I mean, but like, man, I don't even know honestly, like as a parent, how we would have done it had we not had the diagnosis early. I don't know how my husband's parents did it without a diagnosis.
I mean, here's the thing though, and I think this all the time. I feel like when you have a kid, because they don't come with an instruction manual, we
Hmm.
are actively creating our internal narrative from our observations, the situation, what we know, etc. And we're also helping to support the narrative of that child. And so like it is really interesting because and especially like when I've worked with kids who've gotten like chronic illness diagnoses in their teen years or late teen years, a huge question for me always is kind of like, does that feel better, right, to the parents of knowing this thing? And like, does that help support your own being able to give yourself grace, right? And being able to be like, we did the best we could. And also, there were things that we missed because of like this other piece. And I do think that like, even if it, because I see this a lot, right, in practice with teens, is that there is this component where parents are like, oh, they're just lazy, or they're just this, or they just like, they stayed up too late last night, or they played too hard at their game the day before, and they see it as a choice or as a behavior versus a true like medical component. And like, I'm not here to shame any parent because I absolutely understand that they're like doing the best they can, but I think that like when you look at it only through that lens, it does show a kid that like, you could probably chalk that up and make the assumption, but I also feel like we have to go back and make sure that like their body's okay.
Yeah. Well, it's interesting that you just phrased it that way because I think I'm going to go have a conversation with my husband after we finish because she comes home from school. Now, we lived in a two-bedroom apartment for 11 years. We've been here 11 years. We just moved into this house in September. So she shared a bedroom with her sister that whole time. Now they have their own bedrooms. So for the last 2.5 months, 3 months, she has come home from school and immediately gone to her bedroom, and we don't see her until dinner. Now, some of that's because dad works in the breakfast area, which is also tied to the living room and the kitchen. So like, like, okay, I can't be downstairs. What do I do? And we don't have like a TV room. We don't have a TV up in the common area that's upstairs. So she just goes in her room and she draws. So she will go in her room and she'll study, or she draws, or she goes to sleep. And some days she just goes to sleep. And he gets so irritated with her. And I didn't even think about it from that perspective until you just said that like, is that a behavior, or is it literally that she has like used up her capacity and needs to recharge? And she is one who that child will sleep for hours if given the chance. And I never made this is really bad because even as a provider, like I did not make that connection until you just said that.
No, but
Like, oh,
but,
you know,
but I think that's a really strong like point of like being able to share your journey with other people and being able to like have those conversations, because like even with someone who's on the autism spectrum or like dealing with like depression, self-injury, etc., it is so easy to get into this like blind spot vacuum where it's like, this is the narrative, this is what we're going with. And I think that like, being surrounded by community and raising children is like such an important piece, because then it gives you that understanding of like, oh, wait a minute, I could see this differently, or like, that's a good thought, right? But
hmm
I think that's the same thing
yeah,
about therapy. Like, there are definitely things that people point out and I was like, fuck, I never thought about that, right?
yeah,
um
yeah, for real.
but also like, I think we're both in that space where it's like we are able to admit that and able to be like, yep,
Yeah,
like that could totally be part of it.
yeah,
And I think that is such a strong reflective part in parenting, especially when you have a teen with chronic med, is like, it's okay to look back and be like, fuck, I was wrong, right?
like I did not handle
Like
that
all of these
right.
behaviors that I
Yeah.
thought were choices were actually survival.
Yeah, and I think, and actually, it's interesting because, like I said, I don't know how his parents did it. Well, I do know how his parents did it. They didn't know, and they called it lazy, and or whatever word they chose to use, and did their best with what they knew. To the, I'll give them credit, they didn't know, but I'm seeing the pattern reflected out in him, where he will do the same thing, and he gets really frustrated. And it's funny because the things that he gets frustrated with her about, I'm like, but you do the same thing, like you do the same thing. and and now I'm like, well, was that actually depression or was that just survival? It was cold, so you went to sleep because that's what your body needed, because you were hurting. Like, oh, all right, so now I'm like, oh, I got to give myself some grace. I got to give them some grace.
I also
Like, I have to talk to sister and be like, take a breath. It's like other things going on.
I also think, to be fair, and like I have heard this so much growing up, and I'm like, a younger-ish human, and like I remember people being like, "Oh, if you sleep until 1, you're lazy. If you do this, you're lazy. If you come home and take a nap, you're lazy," right? And we have to remember that like the hustle culture that a lot of us were raised in and forced to accept isn't something that like I want to emulate for my kids, and it's not something.
It's certainly not super healthy.
Right, but I also like I don't want anyone to feel like they can't take a break for their body or their mind. And like that's the other piece of this that I think is really interesting, is that there are a lot of narratives out there of like, I grew up with a chronic illness, and like the common response was, I'm just lazy, right? You're not driven enough, you're not motivated enough, you're lazy or whatever. When in reality, literally your body is like trying to survive the best way it can with all of these other issues, and that you're trying to process it in a way where like you can still get through it. But I also think too, like one of the things I talk with my teens all the time about is like, hey, like it's okay to take a break, right? Like it's okay to sleep until noon on a Saturday if like that's what you need and that's what feels good for you. Maybe don't do that every day if you have other things you need to do or school you have to get to, but like I think role modeling that break, and role modeling being able to take care of yourself, and role modeling the ability to recharge is like such an important part when you're working with someone with chronic illness, because then it also is showcasing that like your physical health is important.
Yeah, it's interesting that because it's funny because I don't necessarily, I'm on hormone replacement therapy, so I have some of that going on, right? Like that just started, and testosterone has been a lifesaver for me. Like I'll just put that out there. like like I can function again. Legit. After 2 weeks I can function again. But my husband, who has EDS also, he gets irritated with me because I want to go to bed at like 8:30 or 9 or 9:30 or 10 at the 11 at the latest, right? But for me, when I'm up, I'm up. Rarely do I take a nap. Like I have to be sick to take a nap. I will just go until I'm done, and then I will go to bed. He will get up, and probably 5 of 7 days he's taking a nap right after lunch. Even if it's only 10 or 15 minutes, he's still laying down. And I never made that connection that that's probably just body. We're done, you know. And it's interesting because I know even as therapists, like some doctors will say this, natural, like functional doctors will say this, holistic doctors will say this. I say this to clients. If you don't let your body rest, it will shut down on you and it will force you to rest. Like it will just force you to rest. And it will do it at the most inopportune time possible. And so like now I'm like, oh crap. I gotta go be like, all right, I get it. I'm sorry, to him. because, and I think it's because I hear him talk to her the way that he talks to her, forgetting that like we're dealing with a chronic thing, because like in the middle of all of it, like you said, like you got to do it in community. Even as a therapist, a mom who's a therapist, like 90, it's so funny because there are times where he's like, why don't you know what to do here? And I'm like, because it's my kid. Because it's my kid. I'm like, and so I will call my person who happens to be my pastor and be like, all right, here's what we're doing. Here's what's happening. And she will literally be like, what would you say to a client? And I'll rattle it off and she will rattle it back to me verbatim. Just, like she asked me, I know what to do. It's not that I don't know it's that I'm in the middle of it with my kid. And I think it's the same. Like that's what I'm now realizing, interestingly enough, through this conversation, is he forgets and then he gets irritated. And I think I'm probably gonna have to look at him and be like, I'm gonna need you to slow your roll when you call her lazy or when you get mad at her for being in her bedroom because you take a nap in the middle of the day and she can't because she's at school.
Right. Well, and I think too, like, I don't know, I have this debate a lot because I work with teens, and my schedule with my teenagers is much different because they're in school during the day. So a lot of my work is more of your second shift and weekends and on call and whatever. And there are so many therapists that are like, I will only work 9 to 3. I only want to work 10 to 4. They're very rigid, structured hours, which, like, not going to knock it. That is for them. That is fine. But when I think about, like, our profession, and I think about, like, police officers and ambulance people and EMTs and first responders and any medical, all of those things, res facilities, nurses, hospitals, all of them are staffed 24/7. I like to think about it in terms of, like, me building my life and my career around, like, what actually works for me and my brain versus what other people tell me I should be doing. Because if I did that, I would only be seeing a handful of teenagers because everybody else would be in school during the day and I'd only have a certain amount of hours at the end of the day. So I think when we're talking about, like, chronic illness and EDS and, like, kind of anything under that umbrella, there is this point of, like, how do we help them craft the best life that really fits what their needs are versus us being like, you have to work a 9 to 5 job.
Right. Well, and I think it also like that, but also like recognizing that every kid's needs are going to be different in terms, and not just needs, but like what they're good at. Like and it's funny because she draws. I mean, the kid could be an artist. It's freaking amazing, some of the things that she comes up with, but she wants to be a forensic pathologist, like CSI kind of thing, like Barry Allen. Just the Barry Allen part, not the Flash part,
Right.
right? Like just the Barry Allen or Spencer Reed. Like she's really
My
into
favorite.
BAU right now. Like she's like, oh my. And the funny thing is like she got the same haircut as him. She dresses like him. Like before she even knew him, it's so funny. Like before she was even really watching Criminal Minds, she was dressing that way. She has the same haircut. Like it's so because my husband's dad passed in September, so we were there in November for his service, and she won't wear dresses. She won't, and I won't. Or that's not a battle I'm gonna have. Like wear what you're comfortable in. I don't care. So she wears dress pants, and she had a button down white dress shirt on with a vest. It was, and she's like, Mom, I'm totally giving off Spencer Reed vibes. And I was like, you are right. You are 100% giving off Spencer Reed vibes. And then my sister took her to the mall and they're in probably Hot Topic. And she sends me a picture of her holding a t shirt of Spencer Reed in a vest with her in her vest. And she's like, look, we look just like each other.
I love that so much.
And I was just like, well, I'm glad you found your thing. And so she wants to do that, but like I think the cool thing there is you do it as you're able, like she really wants to work for the FBI and we've had to have some conversations. She's thought about the military and we've had some conversations about you may not be able to do some of those things because you may not pass medical for those, I think the FBI would be different, but like military, I don't I'm all for her trying 100%. But I don't, I'm like, I'm not so sure she'll make it because of the medical stuff. I mean, to her credit, the only meds she takes is ibuprofen and Tylenol. Like, that's it. So it's not like we're taking stuff that would get her in trouble or, whatever. She manages. And eventually I will let her read Fourth Wing. She's just not quite old enough for that yet because the main character, in fact, I told my client whose daughter just got diagnosed, who's 17, hey, you should get her this book because the main female character in this book has EDS. And she was, well, how do you know it's a fantasy book? I said, because the author said. The author said she has EDS. And I said, and she does freaking amazing things. I mean, obviously it's fantasy, but I think the encouragement is you don't have to let it stop you. You can do the thing.
Well, and that's the thing I think is so important in terms of, like, representation and, like, cultural stuff and, like, social media is, like, really seeing all the people that are very successful and have found a way to, like, live their life that meets all of their needs and allows them to explore and kind of, like, be happy and do things that are fun. And I think that that's the piece that I get kind of in my grind about when I'm working with someone who has, like, a chronic med issue is that there's so much pressure for them to conform to, like, normalcy and to, like, what the normal routines are and someone who's neurotypical. And it's like, I hate that so much for them because it's just reinforcing this idea of failure instead of actively helping to support them in problem solving and figuring out for themselves how do they want to do this.
Yeah, and I think That's, I mean, it's, you said it, neurotypical. As somebody, I have diagnosed ADHD. I don't ever want to go back to a 9 to 5 job. I mean, I work a 9 to 5 job. I work 9 to 5, 9 to 6, depending on the day. I see a lot. My kids are all, I have a few children and teenagers. I see them in the afternoons, or I talk to them in the afternoons after school. In the way my life works right now with my kids and our schedule, I can't do the evenings. And if I don't take the weekends, I'm nothing for my family. So, like, I am one of those therapists who's kind of rigid about their schedule, but it's just the season that
But
I'm in. You know what
that's
I
not a
mean?
bad thing, right? But it works for
Right,
you. And so I think
right,
that like there are so many different types of therapists, so many different types of clients, so many different types of needs that I feel
right.
like as a profession, I understand we are professional, even though the Trump administration thinks we are not. Um,
Well, I mean, but I don't even think that's actually what's going on. I think that's a media, twisting that a little bit. But I definitely feel you on that one. I'm like, I had to dig into that because when I first saw it, I had a knee-jerk reaction to it. And when I really dug into it and I thought, okay, that's not really as bad as it seems. Hopefully it works out the way they actually intend it to work out, which is lowering tuition costs.
but so I think the thing is
You
that
know,
like
but yeah.
when we're talking about our field as therapists and we're thinking about our client base and
Hmm.
anyone, like having accessible practices, having accessible things even that fit
Hmm.
like us and our like framework is so important. So like I'm never going to judge
Right.
someone and I'm never going to tell someone that they should be
Oh yeah.
working, like late at night.
Yeah.
But like I love those like 9 o'clock p.m. sessions because I feel like the kids are all tucked in. They're like home for the night. They're just like, there's
Yeah.
nothing else that they have to do. There's less stress and
Hmm.
they really get to dig into whatever they're talking about. In the same way where
Hmm.
like I do have some kids with different chronic med issues and like sometimes that means that they're last minute rescheduling or canceling because they have a really bad migraine or they like physically can't move
Right.
or they've literally exhausted themselves so much that day that they're out of spoons.
Yeah, for sure. And I think, I mean, because I went through a season when I first started doing, I do mostly virtual, but when I first started doing virtual, I was working till 1 in the morning after my kids were asleep. Like, I was with my kids during the day and then I was working at night and it worked until it didn't work anymore. And then I was like, okay, something has to switch. Like, we got to flip this around. And I did have some international clients at that point, which was partially why I was working as late as I was working because time changes and stuff. And so I don't have those clients anymore. Almost all my clients are in my time zone at this point. So like it's a little easier and I have all ages, so I don't necessarily need to have the evenings where I'm working all the time. Do I fully expect that I will always forever be an 8 to 5, 9 to 6 therapist? No, I'm fully aware that at some point my kids are going to be out of the house and I'm going to go back to working with teens a little bit more prominently because that is if I had a choice, that's my age group. But I'm living it right now. And there's a part of me that's like, I don't want that many of them because I'm living it right now.
No, no. Like in all fairness, I hear that a lot from different people because like my entire practice is teen focused, and so like everything from the ground up, paperwork, consultations, onboarding, every single piece of my practice is built towards teens, and I hear it so often from people who like, oh yeah, I can't wait to get back in with teens, right? Once their like kids are through that like phase of life. So that's like super common to me. But teens are like my only population, I feel like. So and I joke around that it's like if I couldn't work with teens, I would quit being a therapist like tomorrow. I'd be like all done.
I mean, fair. I mean, because when I first started, I worked with kids and teens. I'm trauma trained, like TFCBT. I did get trained with DOD, well, through the DOD. It was not with the DOD. Star Behavioral Health Providers, that program to work with military members and their families and vets and stuff. And so I've got like cognitive processing therapy and prolonged exposure, lots of training in trauma. And I worked at a nonprofit and I worked with kids and families and I worked with CPS cases and I hit a point where I was like, I can't do this anymore. Like I had a 2-year-old and I was going to the park and I couldn't stay at the park if there was a single man that did not appear to have his own children, like without like freaking out because I was like going there in my head because of what I had heard from clients. So at that point I went to my boss and was like, I gotta switch. Like I can't do trauma anymore. Yeah, I can't. And so at that point, they moved me. into more of a case manager role. Like I was doing wraparound, so it was more, I was still working some with trauma, but it was more like resourcing for families that needed a lot of other things. And so I ended up with a lot of ADHD kids and a lot of autism kids. So I got a lot of that kind of stuff. And then there were a few that had like chronic stuff and that was impacting school and that kind of stuff. And then eventually we had the polar vortex of 2014
Oh, yes.
and my first snow day as an adult where I could not go anywhere because I could not go anywhere because blizzard conditions and it was 40 degrees below zero in South Central Michigan, which never
Yeah.
happens, and I looked at my husband after that when winter lasted until like almost my birthday at the end of May, that year, and I looked at him and I'm like, no more. Like you said, we were moving to Texas. That has to happen this year. This marriage will not survive another Michigan winter. We're not doing it. And so I started looking for jobs and I got a job working with the Navy Reserves, like with a contractor doing resourcing for Navy reservists because they don't have access to the things that active duty service members have when you're in the reserves. Like you just don't because you're coming from all over to one place for drill weekend. And so I started doing that and it was a really nice break from kids and teens and trauma and from kid trauma. Obviously, there was trauma because some of them saw deployment, some of them saw some not great things in combat. But it's a different kind of trauma. It's trauma, but it's different and it hits differently. And at that point, I realized I really enjoyed working with vets and adults on some level. And so I was like, okay, so I'm going to keep doing the adult thing. I'm going to add in the kids and teens as I'm able here and there until my kids are grown. And then I will go back into, I want to hit kids and teens again. I am not the cool parent in my house most of the time. That's usually my husband. He's the one who knows all the lingo. Um,
Fair. I'm trying to keep
like
up on it.
my kid throws around the 6, 7, and I'm like, what in the heck is that?
Oh my God. No, fair.
you
Fair.
know.
So I
Except for as a Michigan kid, I definitely understand Ohio. I'm like, yeah, that tracks. Like 100% got that.
So I'm curious going back for a second because I know you had talked about some neurodivergency within your family and then also like the complex kind of like medical piece. And I guess I'm curious like how do you like navigate that within like your whole family system of like prioritizing like people's wellness, support, like what they need because those things can differ a lot.
Um, so if I could ever get my husband to actually like own the fact that he's also on the spectrum, I think we'd be in a much better place. Um, I've been telling him that for 20 plus years. He didn't really believe me until 3 or 4 years ago when he watched a TED Talk with Elon Musk and said, I really see a lot of myself in him. And I said, uh-huh. And he goes, did you just uh-huh me? And I said, yes. And he said, why? I said, how much do you know about Elon Musk? And he goes, I don't know why. And he's on the spectrum. And he was like, oh. I'm like, yeah, see, I've been telling you for 20 years. Like, and I think it's interesting because I would like to see the statistics, but I know there are significant statistics that EDS and like autism or ADHD actually tend to go hand in hand. Like they dovetail a lot, right? And so like I don't know what the actual statistics are, but I know they're pretty high.
It's
Um,
a really high correlation.
yeah,
Um,
yeah.
so
And I thought it was very interesting that like I was seeing those tendencies with her and with him from the get-go, almost from after like when we met. Like I knew going into marrying him that he was on the spectrum. And then there's me who was undiagnosed ADHD until I was 32. Like after grad school in counseling practice, getting diagnosed. I knew, but like it was official at 32, right? We just do it. It's kind of like to your question, it's kind of like what I was saying earlier about like my kid just figured out what works. And when it doesn't work, she finds something else. Honestly, I think we just do it. We don't always recognize that we're doing it. I let him now that, especially now that I'm realizing after our conversation, like, oh, that's why he takes a nap. I will push back on him when he starts going in on her because she's sleeping or because now if I feel like she's sleeping too much, then I will step in and be like, hey, I really do need you to move around because moving will help. Laying on your bed, being in your room in the dark is not always the best answer kind of thing. Like, hey, let's go. But she will often come down and be like, I'm going to go take a walk on her own. And she'll just go walk. And I'm like, okay, stay in the neighborhood. We have street lights in the neighborhood. Don't go outside of the neighborhood, you know, kind of thing. And she does. I think we don't have it formalized. We just do what we need to do. Sometimes it causes arguments because sometimes I will recognize something before he recognizes, and he'll be upset about it, and I'll have to yell to get him to listen. I think it's trial and error a lot where you just, that didn't work. We're not going to do that again.
I was gonna say, I think that like part of the journey I have like helped people with is like staying committed to just like learning and uncovering new information and like
Hmm.
knowing that like there is no straightforward trajectory, right? In the same way that like every kid is different, everyone's journey with EDS and PANS and any of those other pieces is very individualized. And so like the
Hmm.
things that are the most priority for somebody else would be different for like you and your family. And I think that it is a lot of like collaborating and a lot of kind of coming back together and like reassessing and figuring out like what helped, what didn't, why, right? Like
Hmm.
there is such a deeper process for that than like, oh no, that just didn't help. And then I think the other part too is that like as your kids and your teens get older, they may respond to something differently. So it's like it's hard to because it's like that means it's never always throwing away the skill, right? It could just be putting
Right,
it on the
right,
back burner for now until they
right. Or that shelf back there.
exactly
Yeah, let's just put it up there.
right until they've
Yeah.
reached a point where like it makes sense to trial that again, and then
Hmm.
obviously like you're gonna have good days and bad days. You're gonna have days where like everything starts to it feels like it clicks, and then days where like everything feels like a volcano.
We have those.
Totally, but I think that
Just, yeah.
I think that's like
Mhm.
part of the journey though, is like really just staying committed to that long term piece and knowing that like there's gonna be an
Yeah.
ebb and a flow, there's gonna be good and bad, there's gonna be like things that work and things that
Yeah. I think the other part of that, that going back to that humility piece, as a parent for sure. And my husband struggles with this, but he gets there eventually. It just takes him a little longer. Is the knowing when, even if you don't know right away, when you've not handled something well, and being able to go back to the kid and say, "Hey, I'm really sorry. I did not handle that well. I reacted badly. It wasn't about you, it was something in me," or whatever, however you say what you're saying. Um, I think as frustrating as for my kid, because dad tends to explode and then he'll backpedal and be like, "Oh crap, I didn't do that well." Ironically, she does the same thing. So like she will overreact and explode, and almost immediate. Now for her, at least to her credit, she knows pretty quickly that was I didn't handle that right. I was pretty disrespectful. I need to go make, whatever. So to her credit, she's gotten that from me. Like she will come very quickly and say I'm sorry. And the example is, so we've been here for 3 months. We just got her a bed set, like a frame, right? So both girls have been on mattresses since we moved in, and we got her a bed frame on Sunday. I think it was Sunday, Saturday or Sunday. Put it together, and no, it was Sunday night because Monday she slept in. She overslept on Monday because it was good sleep because she was on an actual bed, right? And so I had to take her. She did. I went up at like 5 minutes before the bus was going to be here and be like, "Are you moving?" And she was like completely out cold in the bed. But putting that bed together Sunday night caused a meltdown, caused language that we don't particularly enjoy. I mean, it gets used in our house, but it was used towards us, not just, you know, in general. And she was disrespectful and rude and all the things, and in tears because it was a full-blown meltdown because I've been on a mattress on the floor for 3 months. It's actually worked for me, and now you're going to put me in a bed and I have to go back to school after a week off tomorrow, kind of. So she's like doing all the things, right? And my husband's frustrated because, he's trying to figure out where height level and all of those things. And she's just like melting down and he's not knowing what to do with it. And he got frustrated. And I was like, I'm going to need you to like go downstairs and take some deep breaths. Let me like figure this out with her. And I got her to that point and we got her bed all set up and she got it all situated. And within 15 minutes, she came downstairs and I would think I was in the shower when it happened because it was late. And she came downstairs and she was like, "I'm really sorry I swore at you, Dad." And he was like, she came down and told me thank you and told me she was sorry. And I'm like, yeah, see, that's how it's supposed to work. Like, oh crap, that was not okay. I didn't handle that well, and I didn't have to prompt it. She did it on her own. I think that in terms of like some of those things like you were talking about, like I think it's all trial and error, but I think part of it is being humble enough to be like, "Ah, I fucked up."
Yeah. I think that there are parents that struggle with that because they're like, oh, that gives my kid the upper hand and that, like, gives me out of control and I'm not in power, whatever. But really, what we're doing there is we're role modeling for our teens, like how we make repairs, how we can come to the conclusion that, like, we might have done something that we're not proud of, right? Like, we're opening the space for that. Um, and not like giving up. Like, you're not giving up in that moment, right? But like, that is us as adults being accountable role models for the teens that we're trying to raise that are eventually going to be adults that are maybe going to have their own kids or own families or friends or whatever, where they're going to need to know that, like, that's a skill.
Right. What's a what's a healthy interaction? Period. And when you screw up, how do you own it? Yeah, and I think going back to the current administration, that's one of my biggest beefs with them is they can't own up when they screw up. Just own it. Yep, we screwed up. Sorry. We're going to fix it. Here's how we're going to do it. I think that's something a lot of adults have trouble with. And it's a generational thing. It's not just we don't want to admit it, it's we don't know how
I was going to say, I think
because we
that it's,
haven't seen it role modeled for
yes.
us.
It is so hard to like take that step, especially when it's something that hasn't been role modeled for you. And so like in a lot of my work with teens, like that's a really big part of the parent work is like, when do you apologize? How do you apologize? How do you make amends? How do you repair after a rupture, right? Like those are all really important parts. So like we can do a ton of work with the teens, but if the parents aren't involved with it as well and they're not like, in it, how much change is really going to happen?
Yeah, well, and it has to be genuine when the parent does it. It can't just be like this surface level. I mean, initially maybe surface level, but like teens are smart. And I don't think a lot of times I don't think parents give teens enough credit for how intuitive and how smart they are. And I mean, I think that's why I like kids because they will sniff out disingenuous so fast, even if they don't know that word. Like they know that you're not being genuine with them. They know that you're not being authentic and they will call you on it. Sometimes in the most disrespectful ways possible, but they will call you on it. And um I think that's where like often sometimes when that happens, parents are like that was disrespectful. And it might have been, but it doesn't make it less right. Like they might absolutely be right about what's going on, even if they're being disrespectful about it. And you have to be able, like, I think that's another skill parents sometimes struggle with is the ability to tease out and pull away from, okay, the tone of voice and the way it was said was disrespectful, but the actual meat of it was true. And I probably need to listen. And yeah, and if you can't get a parent to do that, then unfortunately you're gonna be dealing with the same stuff with the teen when they're 30, trying to figure it all out. So
I mean, we as parents, as whoever, like we are the first, essentially like neural pathway models, right, for like the kids and the teens that we're working with, and so it is like so critical, right? The parents are able to step into that and like really role model all the things that they want to see in their kid, themselves first, right? I know there's a lot of parents that'll say, "Oh, like do as I say, not as I do," right? But that's one of the key components of like, no, like the reason they're like, up your butt and doing all this other stuff is because that's what you've role modeled for them.
I have to say that to him frequently. But you do that. That's why they do it. Like, you know, and I think it's different when it comes from another adult looking at them and being like, "No, but they're just modeling what you've done." Like as opposed to the kid being like, "Well, I learned it from you." you know. But yeah, I think it's even in the context of chronic pain, chronic whatever it happens to be chronically, because you can throw autism and ADHD in there because it's chronic. It doesn't go away, right? I think it's almost even more important in those situations to be able to step back and be like, yes, my kid was disrespectful in the way that they conveyed what they were conveying, but what they said was true. And then being able to go to the kid and say, okay, I heard what you said. Let's talk about how you said it and how to do it differently, because the point of parents is to teach. Like, that's parenting. Parenting is about teaching. And sometimes when they're real little, yeah, we want compliance. But when they're teenagers, we don't necessarily want we want compliance. Let's just be honest. We want compliance, but we don't necessarily want compliance for compliance sake.
We want connection, understanding, and then
Yes.
compliance if it
And
fits.
right, exactly. And like, thank you. That was a much better way of saying it. I was having trouble with how I wanted to word that. Because they're when they're little, you just need them to do what you're telling them to do, because for a lot of reasons they don't need to, for a lot of things they don't need to know that. When they're teens, you're going to get so much better quote unquote compliance if you can tell them why. And then it's not compliance, it's actually doing the thing because they understand.
Well, I was gonna say, I think like the way that I've always explained parenting is like, if you have a newborn, right? You start out and you're in the driver's seat and that kid is in the back, right? And then you slowly move up that they're like next to you and they're like, in the passenger seat, right? And then eventually you switch seats and they get to drive and they get to choose, but you're still there as a guidance and as a support. And then the last step, two last steps, right? It's like next you're the guardrails, right? And you're just like, let's stay on this path because this is where we need to go. But like they can make a lot of decisions. And then the last one is like, hey, we're at home. Let us know if you need directions. And that is like a perfect trajectory of like parenting from start to finish, because we can't control. Eventually we have to accept the part of like we cannot control what they do. We cannot control what they say. We cannot control how we act. We have to hope that the investment we put in them and the morals and the values and the skills that we have taught for them and like role models potentially are there and are going to stick, and that with reinforcements they will get there and make the choices that are good for them, which may not be the choices that are good for us or would have been good for us, but we're different people.
Yeah, no, man, I'm stealing that analogy because that is a great analogy. I love it. I never thought about it like that. Sometimes you end up in the back seat because you're the one who's being carted around as a parent, because the roles have completely reversed, right? Or maybe that's the next step after the we're at home, call if you need directions. Eventually the parent is the one who's being driven around. That is a really definitely stealing that. I think that's even more important, I think, in the context of chronic pain, because I think it's, like, you want control because you want to fix it, and you have to recognize that at some point you have to let your kid.
Yeah, I think about it in terms of like, we're a big part of their life and we want to be part of their life for as long as we can be part of their life, but there's always inevitably going to be a point where like they are going to have to manage that independently, right, out in the world with whatever life they want for themselves. And so if we do it all for them and we never help support the skills and allow them to fail and like understand what went wrong, they're never going to be able to get there, right? And then we're raising enabled kids who like don't understand how they can actually do it for themselves and have confidence in that skill.
Yeah, and I think that's the hard part when you're dealing with chronic pain, is because you just want to fix it and you just want to make it easier. And the hard part about making it easier is sometimes in making it easier right now, you make it more difficult later. And that's a hard balance to find. Like, when is it okay for me to just do the thing for my kid versus when do I need to step back and let my kid figure it out?
I think there are a lot of families that are dealing with more like niche issues maybe that find themselves very alone, right? And so if like anyone can listen to this podcast and feel like they're seen or they're heard or like they have a shared similar journey, like that the goal is reached. And so because we didn't do the intro in the beginning, do you want to give us a quick snapshot of who you are and what you do and where you are and like anything practice oriented?
My name is Becky Shaulis. I do go by Rebecca for legal reasons and professional reasons. That's my big government name, right? But my friends and family know me as Becky. I live in the North Texas area, just like about 30 minutes north of Dallas. I've been here, like I said, for about 11 years. I have two teenage daughters, one who will be 15 in January and another who will be 17 in June. Been married for 20 and a half years at this point. I can officially say this out loud at this point. We let the family in on the secret a couple weeks ago. I have a baby in heaven who would be 21 in August. So there's that too. It sounds weird to actually like put it out there, but like we've told people. So in terms of my practice, I practice virtually. Right now, I'm only licensed in Texas. I'm working on New Mexico, so we'll see about that. But I work with kids and teens and adults and vets, and I do some couples work, and I really like family work because systems kind of thing. Like I said, I also do a lot of trauma work. Trauma, I'm personally am neurodivergent, so I work with neurodivergence a lot. And then obviously this the normal everyday mental health stuff like anxiety and depression and grief and those kinds of things. The chronic pain little niche is kind of just starting. I never I had not until recently made that connection that maybe that was something that I could help people with, especially teens or parents of teens with it. So I'm kind of excited about exploring that and seeing like, is that something I can kind of pull in now since I live it, you know? And I think it's really interesting how, and this is something that I like have experienced personally, but like I have tended to gravitate toward the things that I have already dealt with. So I work with people who have ADHD because I have ADHD and I get it. I work with some people who are autistic or on the spectrum because I'm married to one and I have one. And then I've done some of that work already. And and then also like grief, I don't know anybody who's not grieved. So there's that, and then like just now, like I just said, like maybe that whole teens with, chronic pain is a thing that maybe I start looking at because I'm living it with my kid.
Well, and I have to say, like, I get a lot of teens that ask me about my own like past history, right? And why I became a therapist and all that stuff. And what I always tell them, because I've run marathons, I've run triathlons, I've like, I did a lot of like intense like physical activity. And what I always say is I would never hire a marathon trainer who's never run a marathon. Right. And so like it doesn't necessarily just like over disclose, but to me it gives them enough information where it's like I love what I do, not just because I enjoy working with other people, but because like we've all fought our own battles as therapists. And I think that like that's such a healthy way to consider like the peer on peer model is like, we're in this for a variety of reasons. We're helpers for a variety of reasons. Like many of us have had like those struggles. And like my favorite quote has always been like, be who you needed when you were younger. And I'm just like that.
Exactly. Yep. And same. I wish that there had been someone in my life who had noticed what I was struggling with when I was in school because I was a good student, but I struggled with focusing and I struggled with perfectionism and I struggled with feeling like I was a failure because it took me longer and more work to get the grades that I was getting than it did my peers because I had to do extra work for it. And so, and then in grad school, I graduated with good grades. I was cum laude in undergrad, but I had to work for it. Like it took a lot, and I didn't get it. I didn't understand it fully until a psychiatrist was like, "You have ADHD. That's the problem." Yeah, you're 100% right. Like most of us in this field get in this field because we've struggled through stuff and we just don't want people to struggle through it again, the way we had to. So, that's definitely part of my story for sure.
No, I 1,000% think so. And I think sometimes too, like when I think about, because I do a lot of harm reduction stuff. And when I think about harm reduction, one of the philosophies of that is that you're listening to the voice of the people that are like actively being impacted by like whatever thing you're trying to reduce the harm of. And I think about it all the times in terms of like therapy where it's like, we're told not to for boundaries, we're told not to share because of this, we're told not to, but we have such brilliant brains in this field who have gone through different things, who have found profound ways of healing and surviving and like moving through stuff. And I'm like, so we're not going to acknowledge that.
Well, and I think we're moving a little bit away from some of that. Like, and I think that's a good thing. And I think part of it is because people who are our age are like, wait a minute, why are we not disclosing some of these things? Like, I don't have to disclose everything, but I can disclose that I struggled with X, Y, and Z. Or like my clients know that my father-in-law just died. Like, I didn't hide that from them. Like, like it's a big deal. And I had to cancel some sessions unexpectedly because we had to go, and so like I do think that's changing a little bit. I think and I think it's more because younger Gen Zers or Gen Xers, younger Gen Xers, millennials, and some of those older Gen Zers who are now kind of filtering into the field because they're of that age are saying, wait a minute, not disclosing at all is disingenuous. Like it's not authentic. And if we're going to help people, most people just need to be heard. And they need authenticity, and you provide authenticity by saying, I don't know 100% what you've gone through, but I've walked through something similar. Let me continue to walk through. Let me walk with you through it. Let me not necessarily hold your hand, but I can walk right next to you, you know. So hopefully, fingers crossed, it keeps changing because yes, boundaries, but I don't think disclosure is bad when it's done correctly. Especially with teens, because again, they sniff out that genuineness real quick.
Well, there's always, I think, an appropriate way to use like different techniques. And so I think it's a lot of just like getting consultation and making sure that your, disclosures are on par. But I mean, I think at the end of the day, some of the best therapists I know have been through absolute fucking hell. Right? And they're the fucking most phenomenal people because they have like fought that battle and they get it at a deeper level than most of the other population. And I think that's why like I have really been excited about Teens Uncharted in terms of like having you want to talk about EDS and your experience because you've been through it. You understand what that's like. You understand the journey, right? And it's like giving some hope and some perspective to people that are navigating through that, potentially just finding out about it with a kid at 17.
Yeah, yeah.
So
Thank you for letting me talk through it because like I said, I realized some things today I didn't know, so or I hadn't realized. So I'm gonna walk away from it with, I don't know, my own counseling session.
I,
I don't know. It was great. I
oh,
appreciate
of
it.
course. I'm like so glad you came on today to talk about it. I do think it's such an important topic. And like we said, if anyone can get anything from it, even you, I'm just like so
Yeah,
grateful.
exactly.
So
Yeah. Cool. Well, and then I'm glad that I saw your post. And I was like, wait, I can do that.
no, I love it. I love it. So anyone that's listening, I'm gonna drop Rebecca's information below for her practice in Texas. So that way, like if anything you heard today you liked, I can connect you. Pretty
Perfect.
awesome. So, but everything will be linked below, so that way, like if people want to reach out, they can.
That's
So,
awesome.
okay.
Great.
Good luck with the rest of
Thanks.
your building your kind of like chronic med stuff. I
Yeah.
can't wait to kind of keep tabs on it and see where you are in a year.
It might be a little longer than a year, but I'm
That's
excited.
okay. That's hey,
So,
you know what? It takes
yeah.
it. Growth is progress. So,
Yes. Exactly. All right.
all right, awesome. Thank you so much for today. I had so much fun.
Yeah. Me too. Thanks.
Awesome. Bye.